Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are joined by Dr. Andrew Blaikie and Helena Feasey. Both of them are from St. Andrews University in Scotland, and they have created the ArcLight. Helena, Andrew, welcome to the program.
Many thanks.
Thank you.
So each of you can just tell us a bit about yourself and what's been keeping you busy.
Who wants to go first?
You go first, Andrew.
Hi, thanks so much for inviting us on your podcast. My name's Andrew Blaikie. I am an ophthalmologist. I work in NHS Scotland half-time as an eye doctor doing cataract surgery, lasers, emergency care eye work. And for the other half the time, I work at the University of St Andrews as a senior lecturer in the global health team. And in that team, I lead the ArcLight project. It's a small social enterprise which develops, implements, evaluates frugal diagnostic and training tools for eyes, ears, and increasingly skin as well.
And I'll go next. So I'm Helena Feasey. I'm an epidemiologist and public health researcher. Also, as you said, at the University of St Andrews now. I've been there for just under 2 years. Previous to that, I was living and working in Malawi for 9 years, where I was working more on TB and TB testing. I also have other backgrounds working in companies and sales and marketing. So with that now at St Andrews and the ArcLight project, I both work on the implementation science side and evaluating kind of screening programs, etc. But also I oversee a social enterprise, which is St Andrews Medical Innovations, which enables us to sell and distribute the devices around the world. And we operate on this social enterprise model where we sell the devices at a higher price in high-income countries and use any profit generated to subsidize distribution and training in the low-resource settings.
So it sounds like the two of you in the same room have all the skills that overlap to create this fantastic project.
Well, I think we're missing the design element of this, which has been driven by a guy called William J. Williams, who's an optometrist from Liverpool, who probably around 12, 14 years ago had the first idea about having a very low-cost eye examination tool that uses LEDs and solar panel and rechargeable lithium battery in a small compact device. And he had this idea, and through some collaboration with the Fred Hollows Foundation, actually secured around about €100,000 to develop the first prototype device, as I say, maybe 10, 12 years ago. Then William and I started working together on it about a decade ago now, having been joined up by a gentleman called John Sanford Smith, who was a consultant ophthalmologist from Leicester. He'd written all the books on global eye health, and he knew William and he knew me, and he thought we'd be a good combination to get together and start working on this. So there's kind of three elements to it. Myself, kind of the ophthalmologist, teaching, research, clinical side of things, William, development, innovation side of things, and then Helena with the project management and kind of driving the thing, the whole kind of initiative forward and promoting it globally.
So let's start with the big picture. What is ArcLight, and how is this going to help the healthcare provider working in austere environments?
Yeah, so the ArcLight device is currently predominantly an eye and ear examination tool. So it's a direct ophthalmoscope at one end of the device and an anterior segment loop for examining the front of the eye at the other end of the device. And that end of the device, you can also attach a speculum to turn it into an otoscope. And so the tool is very small, highly portable, and importantly, it uses LEDs as a light source, a small rechargeable battery on the inside, which itself is powered by a solar panel on the surface. And so it's independent of batteries and bulbs breaking or running out and needing replaced. And it's highly robust. You can drop it in a puddle, you can put it through a washing machine, you can drop it from a height, run a car over it. It's very, very tough and will last a long, long time. So really it's offering the opportunity for healthcare workers in all different grades to be able to perform pretty comprehensive eye and ear examination using a low cost but easy to use tool that doesn't need replacement batteries and bulbs.
Yeah, and it's used on, all the continents around the world. We know it's been to Antarctica, up to the top of Kilimanjaro. Something called Project Neptune 100, where it was underwater for 100 days with a guy living underwater, and it works in all these environments. And as Andrew said, it's just robust and so portable, and you don't need the replacement parts for it. So it works very well to improve access to care pretty much anywhere.
And you said this is 10 years in the making.
That's right. So it was probably in William's mind 3 or 4 years in the making. And then, as I say, first prototype around about 10, 12 years ago. And we're now on what we call Mark 4.5, where it's had different iterations involving different charging plugs, different sources of illumination, different quality, battery or solar panel on the side, altering the way that the switch works to the current device. So, and that's been through a range of different funding bodies that have helped us develop and alter the device and do evaluations. So the Overscroft Foundation, based in Leicester, has really supported us very, very, very strongly, as has the CBM Global, which is one of the bigger eye care NGOs that work in Asia and Africa. And they've implemented the device and supported our evaluation exercises and helped us publish different papers in peer-reviewed journals on the eye function and the ear function, both in the UK as well as in lower resource settings. So it's been a long kind of journey, but we're now getting there. There's over 50,000 devices throughout different parts of the world, and that number is increasing every week.
And so can you describe the device? What it precisely does it do? It does have a solar charger on it, and it has two different ends. But so can you describe the device to the listener?
Sure. So it's rectangular. It's roughly about 12, 13 centimeters long, 2 or 3 centimeters wide. It's black. It's plastic. And at one end, it has a direct ophthalmoscope, and at the other end, an anterior segment loop. In the middle of it, there's a solar panel on the surface, which charges the rechargeable lithium battery on the inside, which then powers the LEDs at both ends. And on the other surface, there's a grey button which allows you to switch it on and toggle through the different eye and ear functions. It's got a little clip in it whereby you can just pop it in your top pocket, just like you would carry a pen around, or you can attach it to a lanyard through a loop and have it hanging around your neck. And so it charges just through ambient light as you're wandering around, keeping its power. And so it's small, it's compact, it's easy to use. And I have to admit, within my NHS practice in Scotland, it's a device that I use in 95% of the patients to examine them comprehensively, both the front of their eye, checking the red reflex for things like cataract and corneal scar, then looking into the back of the eye with a direct ophthalmoscope at the optic nerve and the retina for things like glaucoma and diabetic retinopathy. So despite its small size and its kind of simplified design and its low cost, it's still a very effective tool to perform comprehensive eye and ear examinations.
Yeah, and to do the ears, you just add the specula, which come in the pack as well. We provide an adult and an infant specula, and they just clip in. That's very easy to use. That's on the loop end. And as Andrew said, there's various different light settings, so different levels of brightness that you can choose between. And there's also a blue light, which you can use together with the loop. So if you use that with fluorescein drops for examining the cornea, looking for corneal scratches, scars, etc. And you can also have a flashing light setting, which enables you to kind of a fixation target for people to look at. But yeah, so there's a lot kind of all in one pack. And the pack also actually includes some additional features like a portable eye chart for assessing refractive error and a reading chart as well. So everything that is kind of needed for assessing the condition of the eye.
So for the medics starting out, they'd always go into a shop and buy a Heine ophthalmoscope and otoscope, and they're €300-400 for the kits. And you've created something that does everything that that Heine does.
Yeah, well, everything and a lot more, to be honest, because it's got an anterior segment loop in it with a blue light, so equivalent to kind of a handheld slit lamp, and they cost several £1,000s. It's also got a little clip in it which allows you to attach to the camera of a mobile phone, so you can capture photographs and video with the ArcLight device, which you can't do with traditional direct ophthalmoscopes, despite their elevated price compared to the ArcLight device. And certainly all the studies so far haven't really shown any difference in the clinical effectiveness, either using the ophthalmoscope end or the otoscope end of the device compared to your traditional tools. And as Helena was saying there, within the pack, there's also a visual acuity chart for distance and near assessment. It's also got a little Amsler chart on the near card as well, and you can put a pinhole into the near chart to be testing pinhole vision, which allows you to decide whether somebody's poor vision is due to refractive error or not. And so, yeah, really the pack has a very comprehensive set of equipment within it that extends well beyond the traditional devices that you would buy for several €100.
And we also have the advantage that actually lots of people, when they learn to use it, they're trained, they often actually find it easier to use than a traditional ophthalmoscope, partly because it's so thin, it's narrow, so you can get close to the patient's eye and get that better view. I found it interesting. I'm not a clinician, but my husband is, and when I talked to him about this, he's like, "Oh, I don't really want to look in the back of the eye. That's difficult. I don't really do that." And I'm like, "Well, Andrew, show me how to use this. I can use it. It's actually easier to use than the tools that he's been used to working with. So it makes that whole examining the eye more accessible to health professionals and hopefully more appealing."
I think the idea of having this attached to a smartphone is optimal. So if I'm working in an austere environment, I can then get video and pictures and send them to you. You do this for a living, and you'll be able to look at what I'm looking at and give me help on how to treat this casualty.
Yeah, that's right. So it certainly has telemedicine potential there. I mean, personally, I find that function most useful for teaching. It allows you to capture nice clinical signs from the front of the eye and the back of the eye, and then demonstrate them to a room full of students by projecting onto a bigger screen, or even for patient education and showing the patient what the problem is and comparing it to normal. And so that actually is the main use that I find for it in my practice, is education, both students and trainees as well as patients. But you're absolutely right. The telemedicine option is there as well for getting a remote second opinion on something that you're not too sure about, and allowing a quick turnaround from somebody with higher level skills in a bigger hospital. And that's a very effective way of upskilling the healthcare worker in that particular setting, because you're getting a nice educational feedback loop there. But also, of course, the patient gets the opportunity for a higher level second opinion, which might mean they don't have to travel a long way for treatment because no treatment's needed, or importantly, they do have to travel, and the travel is entirely justified, and the specialist is ready and waiting at the other end, knowing the clinical issue that's going to be confronting them.
The teaching is a really good idea for that. I hadn't thought about that in our own classroom, but of course, having the ability to have the cone of light of the ear for everyone to see as you're showing them how to use the otoscope is really helpful, and you can't do that with an extremely expensive Heine kit.
No, it's true, and again, as I say, that I found that a very, very important and useful teaching tool in my practice. So you have a casting app on your mobile phone, and you attach the ArcLight device to the mobile phone. You examine the patient, either their eye or their ear, with the ArcLight device attached to the mobile phone. And then the image that is being collected by the camera is then casted onto a bigger screen, either a projector onto a wall or another monitor. And then you can have 15, 20 students all looking at that as you're examining a patient, or for that matter, one of the other students in the group. And then you can then capture the video, take a still, you can annotate it and explain the different anatomical features that you're seeing, as well as any clinical signs that may be there if it's a patient with disease. So We've published a number of papers on that aspect of its use, and I see that as a really big strength to this kind of kit, not just in clinical environments, but in training institutions, be it medical schools, optometry schools, nursing schools, in low as well as high resource settings.
And you mentioned blue light. So would that be useful in fungal infections?
Yeah, so it's something, a bit of serendipity, really. We noticed that that the blue light, which you use on the anterior segment loop for fluorescing fluorescein is a dye which you apply on the surface of the eye, which sticks to areas of disease, such as an ulcer or a corneal abrasion. And then the blue light fluoresces that, and it highlights the disease nice and clearly. But we've noticed by serendipity that if you shine the blue light, say on a skin fungal infection, the fungus lights up nice and bright, making the diagnosis a bit easier. So we have got plans at the moment to try and develop a dermoscope attachment for the ArcLight, the anterior segment loop end, so as we can broaden the clinical use of the ArcLight device from eyes and ears to also include skin.
Yeah, that's one more thing that the remote medic is going to be benefit from is having a dermoscope, because skin and problems is a big issue that we see on expeditions and wilderness medicine.
Great. Well, that's fantastic, and it's brilliant that the kind of the austere medical community is now interested in the ArcLight device and its benefits that it brings through its portability and robustness, as well as its ease of use. So we're delighted to hear that.
And can you describe the option for a microscope? So you turn the device around to attach to the smartphone, and then how does this work as a microscope?
Well, I suppose, you do have the option if you've got quite a high end camera on your mobile phone with a very high resolution sensor. You can image things using the magnifying loop on the ArcLight and the bright illumination, and then obviously you kind of zoom in and expand. And as long as whatever the target is actually in focus, then yes, of course you can again get very nice, highly magnified view of smaller and smaller structures. So I think we've yet to kind of really explore all the potential of that, but that's certainly an exciting opportunity which we'll look at in the future, because there could be many different options for either looking at blood or for looking at bugs on the skin. Further expanding the clinical repertoire of the device.
So you had mentioned that there's some articles on PubMed. What kind of research has been done on the ArcLight?
Yeah, so there's been a range of different studies performed by different teams around the world, different academic institutions from India to Africa to the Americas, and they have gone through different levels of assessment, from simply comparing to traditional expensive devices in kind of clinical lab situations using simulation tools, to then moving on to clinical studies, whereby you'll be examining real patients with the device and comparing to traditional devices and the diagnostic equivalents, to larger implementation exercises whereby groups of community nurses have been trained to use the device, for instance, to screen for cataract and retinoblastoma amongst babies and infants in different parts of Africa. And so a range of different studies of both the ophthalmic use and the ENT use, say by different groups in both high and low settings. And as yet, the device shows itself to be of clinical equivalence to traditional expensive devices, but with these additional advantages of being, well, firstly, low cost, highly portable, compact, robust, and easy to use, as well as this crucial thing about being solar powered, and so being independent of replacement batteries and bulbs.
So is there any other research that you have in mind, or that you would like to see, or where would you like to see the research concepts go for this device?
I suppose the next stage in the implementation, evaluation, research that we'd like to see would be large scale use amongst general healthcare workers at the community and district level in regions of low resource countries, over an extended period of time to see if this can increase the referral of eye patients earlier for treatment, leading to better outcomes, with the ultimate aim of trying to reduce the prevalence of preventable and treatable blindness as well as deafness in communities. So that kind of study is a big, ambitious study, and was something the kind of study that would take several years to deliver. But at the moment, we've got all the other pieces of the jigsaw coming into place, showing that this device is equally effective as traditional devices, and that we have good, effective training workshops, which we've also evaluated, which shows we can train general nurses to effectively use the device to diagnose eye and ear disease. And so really now we're after large-scale implementation to show, ultimately, that we can reduce the prevalence of blindness and deafness in the population of a region. Because, unfortunately, there are literally hundreds of millions of people with needless visual impairment and hearing impairment in the world. And a large reason for that is late diagnosis, presentation to facilities whereby disease is untreatable. And so we'd like to try and push forward earlier diagnosis for better outcomes and reducing the prevalence of disability.
This autumn, I'm returning to KCMC in Kilimanjaro area of Tanzania, and I'm wondering if we should bring a bunch down to donate. That's one thing, and from the very beginning, we told you as a nonprofit that we'll be donating far more of these than we would be selling, and so bringing them down is one thing, but perhaps we need to have a chat on how we can use that as a data collecting option to see better outcomes for people using the ArcLight. Is there a pre-post study or Delphi study, or what would be a good way to use our connections in Tanzania to better the understanding of this product? Okay,
so it's a good question, and probably worthy of a podcast in itself. So with KCMC, we've got good contacts in KCMC, and we've done a lot of training there, and we've got one or two very close academic colleagues there will be published work from in the Kilimanjaro region. And the next step there really would be to do a rapid assessment of avoidable blindness in the region to get an understanding of the current level of needless disability from eye disease, and then do a mass implementation exercise within the healthcare workers at the community and district levels within the region. And then, to be honest, you'd need to repeat that several years later to see if there's been a change. But of course, in that time, there will also be other interventions occurring within the healthcare system, as well as the eye side of things, which will also be feeding into that. So it's a complicated study to do, and one that would require quite a lot of thought and work from both local partners in KCMC as well as our colleagues at the University of St Andrews in our public health, population-based health science team.
Yeah, as Andrew said, it's kind of getting into that larger scale, the public health and community health aspects of it. And there are various different ways that you can design the study, and some of them are more robust and acceptable, but then often in those situations are very difficult and expensive to do. For instance, ideally we would run a cluster randomized trial, but they end up being very large and very expensive. So you have to kind of balance against the outcomes, against the cost and things like that. But I think we'd very much be interested in this whole assessing of implementation and screening programs, and bringing into that the whole kind of health economic side of things, to see that not only the efficacy, but what the cost effectiveness is.
And Helena, you've spent years in Malawi. Is there an option for study there?
There is, for sure. And actually, Andrew's already done some study in Malawi. And there was actually a colleague of mine when I was there, and he was working together with Andrew and another ophthalmologist who's worked with us called Aebhric, on a kind of additional product that we launched earlier this year, which is the binocular indirect ophthalmoscope, which is a more specialist product. So it's more for ophthalmologists and optometrists. So Kyle was there and working on it and looking at seeing if the bio can be used for helping in diagnosing cerebral malaria in children. Because the malaria causes changes in the eye. So that's something that they're working on there. And I think that paper's been sent off for hopefully publication soon. And Andrew's also worked on other papers with people there. And we've also actually now got a program set up together with the Kamuzu University of Health Sciences in Malawi and the Malawi College of Health Sciences, which is funded by Rotary International and Rotary St Andrews. And that's all about us working with the institutes who are training the health workers so that they can have additional training on eye and ear examination, that primary healthcare. And as part of that, they get trained on how to use an ArcLight and would also get an ArcLight, so that then once they graduate and they go out and they're working in the community, they already have that training and they have the tools to be able to do that as well. It's very much an aim of ours to try and integrate that training and that work with the training institutes which are already there and in country, rather than kind of adding it on subsequently once people are already working in the field.
So you're saying that the ArcLight can detect cerebral malaria, the retinal whitening in the back of the eye?
Yeah, that's right. So we've got two main devices actually. There's the ArcLight device, which is a direct ophthalmoscope that allows you to look into the back of the eye, but maybe only see a 5 or 10 degree wide window into the back of the eye. Then we have this other device called a binocular indirect ophthalmoscope. That's also a frugally engineered, solar-powered, easy-to-use, compact, robust device. But it gives you a much wider field view, maybe 30, 40 degrees. And with that, you can train a nurse to examine the back of an unconscious child or adult to see the characteristic findings of malaria retinopathy, which are associated with cerebral malaria. And that allows you to confirm the diagnosis and initiate the appropriate treatment.
That is fascinating. As a very amateur deep dive interest in malaria, this is yet one more tool that we can have as remote medics to assess for cerebral malaria.
Yeah, and very much part of that research project was to develop simulation eyes which emulate the clinical signs of malaria retinopathy, to be able to then allow us to develop a workshop to train nurses how to use the binocular indirect ophthalmoscope and examine simulation eyes, which are all labelled with the clinical signs, but then test them to see whether they can use the device by examining unlabelled simulation eyes with normal and abnormal retinal changes at the back of the eye before going on to examine real patients on the ward. Because at the moment, no one really has suitable access to an appropriate imaging device of the back of the eyes to make sense of whether an unconscious patient does have cerebral malaria or not. But this we see as an opportunity and a way to effectively add to the diagnostic armory of that group of healthcare workers.
That's definitely one more reason to have this in your medical kit. So I'm curious, which of the different NGOs are you working with? Where have you done research and given donations of the ArcLight?
Yes, we work with all the major eye care NGOs in the world, in all the different continents of the world. So, initially we were largely working in English-speaking Africa with CBM, Christian Blind Mission, and we've worked with them in Malawi and Kenya and Tanzania. But other eye care NGOs have also started working with us in Africa, for instance, Light for the World, Fred Hollow's foundation. And then more recently, other organizations such as Cure Blindness and Orbis International, which were based in America. We've been working with them in Asia, in Bhutan, Mongolia, India, and then sometimes with smaller eye care NGOs that are literally run by a husband and wife couple. For instance, I can think of an excellent small eye care NGO called Sight Relief that are working in Pakistan, and we've been working with them in northern Pakistan in the more mountainous regions that are very remote with very little healthcare infrastructure, and training and equipping the nurses at community level to identify eye disease and refer into the the treatment institutions which are in the bigger cities. So so a whole range of different eye care NGOs in both Asia and Africa. And generally, it just seems to be building and building. As one group starts using the device, the other group gets to hear about it, and then they're keen to understand more about it. And so, it's been very, very satisfying. I'm very pleased with the way things have gone over the last few years as these different big, very creditable big organisations start implementing the device in collaboration with ministries of health in all these different low resource settings.
I'd also mention, I was just going to say that we also work in that remote medicine area. For instance, just last year we sent 50 ArcLights to Ukraine. That was actually an ophthalmologist who contacted us via LinkedIn and said they could really use some of the ArcLights for use in the Ukrainian refugee camps. That was quite a mission to get them there. With the war, we worked with Medics for Ukraine, who are linked with World Extreme Medicine, to get them there. But that they've arrived and they've been very successful, and the military are using them in Ukraine as well as in the refugee camps.
Very happy to hear that. There definitely is a need for that. And speaking as an old military guy, I would say that your combat med techs would be benefited with this. Have you talked to the MOD?
I mean, yes, and we definitely have orders and connections in with the MOD. That there's also an ophthalmologist who works with Andrew, and she's a military ophthalmologist. I think it's the RAF she's with, and she goes and trains military GPs with the ArcLight, and we've also had other requests and orders from MOD. But we're not kind of on the central procurement setup and system at the moment. But it's definitely something that we're trying to explore.
I guess the next question would be the future. Where would you like the ArcLight to be pushed, or what research are you looking at, and what developments to improve? Well, it's hard to improve this amazing device, but what's the next 5 years going to look like for ArcLight?
Helena?
Oh, me. Well, to be honest, a lot of the work from my side that's been going on and will continue to expand over the next few years is actually about ensuring the availability of ArcLight around the world. Obviously, it's a medical device, and we need to make sure that it's a quality medical device and it's not going to break down, be faulty or anything like that. So we've been working very hard on our whole quality management system and the regulatory side of things. Medical devices, you have to kind of register them in pretty much all the markets that you operate in, and then work together with local partners and distributors to make sure that they can be imported and sold or distributed in those different markets. So we've been working on that a lot over the last couple of years, and it's now available in the US, for instance, FDA registered, and we're available across Europe. We also have distributors in Africa, East Africa, South Africa now as well. And we're looking at different markets. So, for instance, India is definitely a big potential for us, but you need certain regulatory things in place to be able to get there. But we're working on those, and that should be happening over the next year or so. So, working on that side of things is a lot. As we mentioned earlier, also that kind of larger scale research, the big programs showing that community level change, so that it can be adopted more broadly. We already see signs of that, and we're looking to expand that further. For instance, in Mongolia, we worked with, I think it was Orbis, Andrew can tell me if not, on a childhood screening program there, and they're now working with the government to expand that nationwide. So, obviously we want to evaluate that and have the research behind that as well. But trying to scale up to that kind of level and working with those large organisations. Andrew's doing a lot of work now actually with WHO, and we're also working together with UNICEF on guidance and support on how you can implement these kind of large scale programs. We also mentioned the other products that we're looking at developing, so there will be other things in future, like the dermoscope, and we're also working on the binocular indirect ophthalmoscope and how that can work, particularly relating to diabetic retinopathy and retinopathy prematurity screening. So those, I would say, are probably the areas of focus. But Andrew, what would you say?
Yeah. So I mean, the area that I'm working pretty hard on at the moment is the establishing and kind of curating all our medical education materials into one single mobile phone-based application. And so we've employed for 1 year a creative media specialist who's writing an app and bringing together all the materials that we've put together over the last 10 years and putting them together into an application which is easily navigated by different types of healthcare workers in different parts of the world to allow them to understand how to use the device effectively to diagnose different eye and ear disease. So we made a lot of progress over the last couple of months since she started working with us. We hope to have a pretty good pilot app up and running in a couple of months' time. We'll do an evaluation of that amongst users a couple of months after that, then iterate it for a couple of months, then hopefully by the end of the year have a good going app that's up and running, which will allow the device to flourish all the more amongst different groups without needing to attend a workshop, either face to face or online with our different trainers that we have in different regions. So that's the kind of area I'm working on at the moment, and kind of aligned to that is WHO are developing their primary eye and ear care training materials at the moment, and I'm having the opportunity to go through them and review them and offer different bits of advice and materials that we've developed to enhance that. And I'm pleased to say that the ArcLight is very much part of the WHO's eye and ear care training programs at a primary level, which we're really, really pleased about, as the device has been specifically developed for that type of user in that type of low austere environment. So, so medical education is one of the big areas that I'm working hard on at the moment.
Well, I'm seeing over the last 18 months that ArcLight is popping up, and I have not attended a medical conference in the last 18 months where the ArcLight wasn't there. So it is making traction. And I know on your website you have the device for sale along with your binoculars and the speculums and a bunch of other stuff. So I highly suggest that people have a look at that. Anyone coming to Malta for a quorum course, we're going to have them in the classroom. I'm really impressed. And I walk through life trying to find better options for the district hospital, the district nurse or the medic working on expeditions. And man, you've made life a lot better because of your device.
Well, good. I'm delighted just saying that. It's lovely to hear it. And as I say, it's been a long journey. We've gone sometimes one step forward and two steps back, but we've gone forwards over the years and slowly but surely beginning to establish it amongst all the relevant professional groups in all different parts of the world that really the device is aimed at. So it's all going the right way, and I really appreciate your support and interest in the device, and it's great to hear such warm, kind words.
Absolutely, and it's great that you're kind of raising awareness and supporting us in that way, because I think, as you said, actually most people, when they get their hands on it and they use it, they suddenly go, "This is great. This is easy to use. It's so portable. I really like it." So for us, actually, once they get hold of it, it kind of sells itself. So it's for us, the raising awareness part is really key. So getting it out there, getting it known.
Helena Feasey and Dr. Blaikie, you have you've created something pretty amazing, and I'm honored to have this in my kit. I'm honored to have this in our courses in Malta, and I look forward to seeing what you guys can do in the future.
Thank you.
Thank you very much.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit free access to our virtual field guide and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.